The Oncotype DX recurrence score predicts the likelihood of disease aggressiveness. So what we were attempting to do when we did the test for invasive breast cancer was figure out which women had disease that would be more aggressive and could potentially benefit from more aggressive treatment. And what we discovered when we built that assay, the 21 gene assay, is not only could we predict which patients had a likelihood of their disease recurring over a 10-year period, we did subsequent studies to show that we could also predict whether or not those women would benefit from chemotherapy. So we ended up in a situation that we had 50% of women in a low-risk group, 25% in an intermediate risk group, and 25% in a high-risk group. Now, even better than that, we were able to give an individual score to each patient. So when we designed the studies initially, we were hoping to be able to identify risk groups. And we were very pleased to see that not only could we identify certain risk groups, we could actually give women an individual score to show them their likelihood of recurrence. So, for example, if you get a recurrence score of 7, that correlates to a specific likelihood of recurrence over a 10-year period. We can also then tell you, is your cancer likely to benefit from chemotherapy? One fact that a lot of people are unaware of is that in early stage breast cancer, so that is ER positive, node negative breast cancer, about 100,000 women each year diagnosed in this category. Most of those women, prior to Oncotype DX being available, would have been recommended chemotherapy based on cancer practice guidelines. Now, what's unfortunate there is that while most would be recommended chemotherapy and most would get it, most do not benefit. So what we know is only 3 to 4% of women with early stage breast cancer actually benefit from their chemotherapy. So we're treating 100 women to find 3 or 4 that get some benefit, and that's what we were trying to impact. That was just not a sustainable way to go forward to treat breast cancer. And so what the Oncotype DX test did was allow us to tell 50% of these women, you have very low risk disease, your likelihood of recurrence is very low, and further we can tell you that your disease isn't likely going to be impacted by chemotherapy. Conversely, we can tell those women that are in that high risk group that they have a high risk for disease recurrence. And while that's not necessarily good news, the good news for these women is that chemotherapy actually will help them a good bit. And so what we hear often from physicians is that while patients get disappointed to know that they have a high recurrence score, it's really helpful for them because they know they're getting a big bang for chemotherapy. They're willing to complete their treatment, and it's much less of an impact for them psychologically, wondering whether, am I going through this very toxic and costly treatment to no avail? And we can say, no, if you have a high recurrence score, you have high risk for recurrence, and you're getting a benefit from chemotherapy. So it's made a very big impact on treatment decision planning for patients.